Two Victorians have died from COVID today, one woman in her 40s and another in her 60s, both of them in their homes. They're the first COVID deaths in the state this year. The news was confirmed as Victoria recorded 76 new cases. 45 of them have been linked back to known clusters and 40 were out and about while infectious. Mary Gearin joins us now for more. Mary, what can you tell us about those two deaths?
Well, Tam, terrible news. As you say, a woman in her 60s, she was from Hume, and a woman in her 40s from Darebin have died. And yes, they both passed away in their homes. Now, that's all the department is saying about it officially tonight. And they are saying, though, it's a reminder that COVID symptoms can worsen quickly, and that if you or anyone you know is in this sort of situation, to call for medical help quickly, or in an emergency, call 000. Now, this comes after the Andrews government announced that tomorrow it would be making an announcement about a roadmap of easing of restrictions connected to case numbers. And also confirmation today that the MCG has, for the second year in a row, lost the AFL Grand Final. Bridget Rollison has the story.
Hope is on the horizon. Victorians enduring their sixth lockdown will soon get a roadmap of rewards.
If we can't achieve zero despite our best efforts, how many cases can we tolerate? It will need to be a low number.
Tomorrow the Premier will announce those targets and the restrictions that can ease when certain numbers are reached. But don't expect big moves.
This will not be Freedom Day. It will not be an opening up type day. It'll be modest changes.
One thing that's already been ruled out is the return of all year levels back at school.
And there's a sense of disappointment that our year level have missed out on making these key memories at a crucial time in our lives. And we would just like for there to be some hope and light at the end of the tunnel.
But the light towers at the MCG have been extinguished, with Melbourne officially giving up the AFL Grand Final for the second year in a row, this time to Perth.
It wouldn't be responsible for us to risk the health of Victorians by rushing back to crowds at a point where it's not safe.
To all Victorians, we will be back at the MCG, bigger and better in 2022.
Less than half of Victoria's 76 cases were in isolation while infectious. 16 are linked to the My Centre childcare in Broadmeadows and another 9 in Shepparton.
Wherever you live in Victoria, and maybe particularly in these areas and Brimbank and Hume, the consequence of letting your guard down, even for a short period of time, is really significant.
56 Victorians are in hospital with the virus and 16 are in intensive care. All but one of those ICU patients are on a machine to breathe. The average age of a COVID patient in hospital is 49.
This virus is going to the unvaccinated. That is to say, it is finding younger people who are not yet vaccinated.
The head of ICU at Austin Health says the sickest patients he's seen are not elderly.
But it's like drowning on dry land. You just cannot get enough oxygen. You cannot get enough air, no matter how much you try.
Victorian Parliament has been cancelled for the second time this month because of the outbreak. But experts say in times of crisis, it's even more important the government is held to account, and it should be online.
Parliaments are sitting in the UK, in Europe, Spain, online. They're voting online, they're tabling bills online. There's nothing stopping Victoria from doing the same. Parliament must sit.
But the Premier says he's prioritising vaccines over speeches. Bridget Rollison, ABC News, Melbourne.
Mary Gearin still with us. Mary, what kinds of discussions are being had at the moment?
Well, health authorities are trying to figure out exactly what restrictions can be eased at each stage of the case numbers going down, and that's a complex calculation, and the Premier did say that meetings would be going on throughout the night, and there would be no details released before that happens. And as we know, the outbreak is still chugging along, and this afternoon even more exposure sites were added across a range of areas from Tarneit to Tullamarine to St Kilda to Shepparton. So authorities are urging people again to watch that exposure site list.
And as we mentioned, the AFL Grand Final's been relocated for the second year in a row now. What's been the reaction to that?
Well, of course, it's a huge blow culturally and economically, and really emblematic of the sacrifices that Victorians have had to make. The AFL and government say they left it as late as possible, 3.5 weeks away, to give themselves a lot of options. The Victorian opposition is saying that the government should have hung on even longer and perhaps considered things like rapid antigen testing or having a smaller crowd. The major events industry is saying it's another blow as well. In good times, that's worth $12 billion in spending. But the AFL and government have said that for the sake of Victorians' health and also to give the big dancer a proper audience, that this was actually their choice that they had to make. And as compensation, they're adding another year to the MCG's Grand Final contract, more premiership matches to the MCG, AFLW matches to go to the regions. All these measures meant to help soften the blow.
Mary Guerin, thank you. Australia has secured an extra 500,000 Pfizer doses from Singapore under a vaccine swap deal. Prime Minister Scott Morrison says the doses will arrive this week and be divided between states and territories on a per capita basis. He says the extra doses will help younger Australians get vaccinated sooner.
That means there are 500,000 doses extra that will happen in September that otherwise would have had to wait for several months from now, accelerating our vaccination program at this critical time as we work towards those 70% and 80% targets.
As a part of the deal, Australia will send 500,000 Pfizer doses back to Singapore in December.